Ewing sarcoma is an extremely rare type of pediatric bone cancer. Cancer is the uncontrollable division of abnormal, malignant cells that destroy body tissue. According to the American Cancer Society, there were an estimated 589,430 deaths due to cancer in 2015 alone. Of these deaths, Ewing sarcoma accounts for only a very small portion, about 75 to 100 per year. However, the lives it does take are of innocent children and adolescents. Ewing sarcoma is a primary bone cancer, which means it originates in bone cells rather than spreading there. The symptoms of Ewing sarcoma are severe pain and swelling in the arm, leg, chest, back, or pelvis, broken bones with no apparent cause, or a fever for no reason. These symptoms are common in other cancers, therefore doctors do not usually diagnose Ewing sarcoma until it is in a more advanced stage. Doctors classify the stages of Ewing sarcoma based on whether the cancer is spread to other parts of the body. To diagnose Ewing sarcoma, a patient may undergo a series of tests including a physical exam and history, an MRI, CT, PET or bone scan, a bone marrow aspiration and biopsy, an X-ray, a blood count, or a blood chemical study. MRIs are considered one of the best ways to test for a bone tumor as they outline where exactly the tumor is growing. MRI stands for Magnetic Resonance Imaging Scan and uses strong magnets instead of X-rays. A patient is put into a tube and will hear loud thumping noises for however long the process takes, usually about half an hour. The radio waves released by the machine are absorbed and released in certain patterns formed by specific tissues and diseases. A computer is then able to translate these wave patterns into detailed images of certain parts of the body. Treatment options for Ewing sarcoma include chemotherapy, surgery, radiation therapy, stem cell transplants, and bone marrow transplants. Ewing sarcoma is known to react well to radiation therapy, although it's typically used when surgery and chemotherapy are not effective. Radiation therapy uses high-energy beams to destroy cancer cells. External beam radiation therapy is most commonly used as radiation therapy and is given from a machine outside of the body. Internal radiation therapy is radiation therapy using implants. Side effects of this treatment include fatigue, mild skin rashes, upset stomach, loose bowel movements, but they go away after treatment is over. However, in the long term, radiation therapy can interfere with bone growth and increase the risk of further cancers. 70% of children with Ewing sarcoma are cured, but the survival rate drops to 56% if the patient is ages 15 to 17. If the disease has spread, the survival rate is less than 30%. Children, adolescents, and young adults are the most at risk for Ewing sarcoma, specifically from infancy to 39 years of age. It rarely occurs in adults over 40. Caucasians are most likely to get the cancer because of the polymorphism in the EGR2 gene that combines with the EWSR1-FLI1 to cause Ewing's is found more frequently in whites rather than African Americans and Asians. Ewing sarcoma is found more commonly in males over females. There are no known causes for Ewing sarcoma. While many tumors originate from a specific type of tissue, for example, breast cancer originates from breast tissue, Ewing sarcoma does not come from a specific type of tissue. Due to its rarity, limited research has been done on definitive causes of it. Ewing sarcoma is not inherited, thus there are not even genetic factors that play a role. Ewing sarcoma was discovered by James Ewing in 1921 when he found a bone cancer that had a different appearance than osteosarcoma, the most common form of bone cancer. It was also found to be more likely to react to radiation therapy. Ewing sarcoma is a rare and unique cancer. It is so rare that many doctors have never treated a case before, and Ewing tumors make up only 1% of childhood cancers. Ewing sarcoma is in a family of tumors called primitive neuroectodermal tumors, known as PNET. 50 to 60% of all cases are found in limbs. The swelling and bruising symptoms of Ewing sarcoma are sometimes confused as usual sports injuries or common wear and tear, therefore not commonly recognized. Ewing sarcoma, as well as all other cancers, are serious diseases, and if you or someone you know shows any symptoms, a doctor should be contacted right away. The earlier it is diagnosed and treated, the higher the survival rate is.